Although the two-point eyelift technique is designed to help you establish exactly where you can place your dermal filler safely, and it is a technique that's been widely used and recognized as one of the safest and most effective techniques for rejuvenating infraorbital region, not every patient is a suitable candidate for this procedure. So what do I look at when a patient comes to my clinic looking for this particular procedure? There are some patients who are simply not suitable. For example, I look at the existence of Eyebags. That is an indication of herniation of the infraorbital fat. If it's moderate to severe, causing the appearance of what I describe as an overhang, excessive overhang of the eye bag, they are likely not suitable for the two-point eyelift, and perhaps maybe consider referring these patients to the surgeons. I look at if there is excessive amount of loose skin in the lower eyelid, and one of the assessments you can carry out is what we call the snap test. You pull the skin forward and let it snap back, and if it takes excessive amount of time to recoil back to the original turga, it is indicating that there is excessive amount of loose skin, and patients that fall into this category are likely not going to benefit from a rejuvenation with hyaluronic acid filler. I also look at the severity of the teardrop deformity as well as palpebral malar groove, because if it's very severe, perhaps this patient should be referred to the surgeon for surgical intervention. The other aspect of this patient, the other aspect I look at is the amount of a volume depletion in the middle part of the face. As part of the aging process, in addition to changes in the infraorbital region, we also undergo volume loss in the middle part of the face. And volume loss can result in extension of the lid-cheek junction. So as part of the assessment, we look at the severity of volume loss in the middle part of the face and consult with our patients if they need volume replacement there as well. And finally, we consider the possibility of lymphatic stasis. And there are a couple of questions you can ask your patients. For example, when they are waking up first thing in the morning, do they have the tendency to have a periorbital edema? And so that's one of the indications if they might potentially have a physiological lymphatic stasis, and that can be due to the aging process as well. Or, from an objective point of view, what you do is you press firmly along the tear trough as well as along the palpebral malar groove and look for indentations, and then assess if it takes quite a while for the indentation to resolve, because if it takes a while for the indentation to resolve spontaneously, it may well point towards the fact that the patient might potentially have problems with lymphatic drainage. So if a patient has lymphatic stasis, they are unlikely going to be a suitable candidate for the use of hyaluronic acid in that particular part of the face. But very importantly, in a general sense, we also want to think about if a patient has a too high an expectation, because that's very important for us to take into consideration. So those are the few things that I look at and I keep in mind and I assess when I see a patient in my clinic for suitability for the two-point eyelift.